hope you have done, seen it, and now when you go to the station, you have to do it. Then comes the proning of the patient. Proning on ECMO. Okay. So we'll show you how to do proning on ECMO. So when you do proning, again, same thing, evaluate the patient, evaluate the safety of the patient. Okay. Whatever is not required, just disconnect that support. Okay. Look at the flow and saturation, that is very important. One person will be looking at the monitor and ECMO parameters so that there should not be any issues with the flow. When you prone this patient on ECMO, the problem is that it can give rise to flow issues because your vessel wall might get abducted to some vessel wall, and then it might get the flow. You might get a flow issues. Second, there can be a chance of kinking. Third, there can be a chance of disconnection. And fourth, patient is on VV ECMO, there is a chance of always a recirculation. So these are the different possibilities that you should keep in mind when you are trying to prone the patients. Okay. So now rest of the proning part remains the same as per your ICU protocol. You can prone the patient. You can give eye protection, face protection, so that the bed sores does not you don't develop bed sores. So usually what we are practicing, my staff will show you how we are doing proning this patient on ECMO. So the first and foremost thing, as I told you, is you have to first secure the jugular cannula. So that is most important. So usually we tie it to the head so that it does not get stretched or disconnected. That is very important. Yeah. The next step is cover the eyes and cover the face to prevent any bed sores and that. And before all doing that, you should always don't forget the basic ICU protocol of doing suction and oral suction in 80 suctions. So all that precautions what you do regularly, that you should always do it. Okay. What I'm telling you is an additional factor what you require to do other than your routine ICU protocols. You have to sedate the patient well before you do all this. Okay. Once everything is done, you have seen the stability of the patient, then what you do is you have to always take the patient towards the cannula site. So wherever the cannula is, you have to put the patient towards the cannula site. Okay. You have to take 3 pillows. You can keep the 3 pillows on the chest and the pelvis and the around knee. These are 3 pillows what you need to keep. So keep 3 pillows. Look at the tube length, look at the connections, look at the cannula, whether there is no bleeding from the cannula site. Cannula site is well dressing been done. So before every time of shift of position, proning and supining, you should always look at the cannula dressing so that there is no bleeding from that. The one person is going to hold the endotracheal tube and the ECMO cannulas. Okay, so one person is going to go behind. With one hand is going to take care of endotracheal tube. With the other hand, she is going to take care of the jugular cannula and hold the jugular cannula. First, pull the patient towards the cannula side. So wherever the cannula is, pull towards. Make 30-degree turn. Wait for some time. See, there is no recirculation. There is no flow issues. So keep a watch on flow and recirculation. Make it 60-degree. Then make it 90-degree. See, there is no problems with the flow or saturation. Okay. Then just flip the patient. Okay. Again, look at the parameters, whether there is no change in the flow, there is no change in the saturation, hemodynamically patient remains stable. And once that has been done, again put the cannulas, fix the cannulas again properly, okay, and the circuit, okay, so that there is no kinking. Look at the flow, no kinking. Put the cannulas, yeah. So yeah, this is the way you can fix the cannulas. Again, connect the patient to monitor and whatever the syringe pump and everything what you have disconnected, just connect it. See to it that there is no pressure coming on the eye. See to it that your suction tube goes well from the endotracheal tube. So all that what we usually do for an ICU, that you need to do it. Now when you are supining it again the principle is going to remain the same. Now you have already pillow on that, so what you can do while supining the patient, you have to just hold the pillow and take it towards the cannula. Now cannula is on this side, so you have to take the patient on this side, hold the pillow. Okay. Yes. First 30 degrees, see there is no issues. Okay. See to it nothing is going to go on the back of the patient, so that keep the length of the tube and everything, otherwise it will get kinked. Pull it further more, 90 degree, and finally flip it to the so this is what you need to do supine. So proning is not that difficult, it is easy, but only thing you have to keep a watch on flow, you have to keep a watch on saturation and hemodynamic parameters, because recirculation can be an issue. The next part of it is going to be mobilizing these patients.